Okay, well, I understand we're trying to get across to Dr. Okay, just until we're having back. Dr. Yahya Damo is the Chief Medical Director, FMC Kefi. Good morning, Doctor. Thank you for joining us today on the program. Well, I know, of course, you know, yes, indeed, some concerns raised. We've had several messages concerned people who have written into the station raising such concerns as to people who were infected, medical professionals, as a matter of fact. I know there was some reference to that in that report, but could you give us your own understanding of what the situation is?
Well, thank you very much for contacting us. The reality is that we do not have any of our personnel who are infected attending to patients. So, we had a doctor who contacted the virus from somewhere we do not really know and came into the hospital. And once we knew about what happened, we made sure he himself and all his contacts were quarantined. And when we now tested all the people who had contact with him, and 2 of his colleagues also happened to be positive along. And on noticing that, we said, well, this must be something that could go beyond what we really thought about at the beginning. So the first thing we did was to close down the Department of Obstetrics and Gynecology, pending when we know the total status of the place. And we make sure the whole department was decontaminated completely. And up till now, as I talk, it is yet to be open. We're only now, because after closing the place, we made sure every person who may have had one contact or the other with him was tested. And the results just reaching us have shown that practically, apart from those 3 doctors that have tested positive, no other person has been positive. So we are looking at the possibility of coming up with gradual commencement of services in the obstetrics and gynecology department.
I mean, because some of the messages we had was that the doctor was coughing, he interacted with nurses, other medical professionals, and then they saw him moving in those areas, and that was why they raised those concerns. Are you saying that that didn't happen?
Well, I'm not aware of that because there was no doctor who we knew was sick that was allowed to come to work. They have a basic instruction that anybody who feels ill should stay at home and give a call to his head of department. But a particular doctor came in, and once we noticed he was not feeling well, we isolated him. Unfortunately, after he had come in, he had contact with some of his colleagues at work, both nurses and doctors, and that really necessitated the immediate closure of the Department of Obstetrics and Gynecology.
You also said that you've talked to all of his contacts. Do these include nurses, patients, and some canteen workers that he may have interacted with? You also, of course, know that 2 weeks before he tested positive, he may have been, talking with people, contacting people, and he may be asymptomatic. So, do these contacts that you traced include patients that he may have interacted with in due time?
Oh, yes. We do have. Hello?
Go on, please.
Yes. In the hospital, we have a public health department, and we make sure every positive case we get in the hospital is tracked and traced to every contact, whether it's patient or staff. There was no exemption in this respect.
True that well, one of the things that's been written to us is that you refuse to close the hospital because of the revenue being generated. Is that correct?
Well, I'm sorry I have to laugh at this moment, but it's unfortunate. For anybody to make such an insinuation is unfortunate because, in fact, even in the accident and emergency, when we heard that somebody had had a contact, what we did was immediately shut down the accident and emergency for 3 to 4 days until we have decontaminated the place, just because a patient that was suspected passed through the place. Even as it is, we ensure that even in front of the emergency, we have a place we call an isolation unit where we try to keep people segregate even with any slight complaint that suggests that before we allow you into the emergency room. So we cannot, for any reason of economic benefit, keep the obstetrics and gynecology open just because we want to make money. I don't think that is true. It's far, far from the truth.
Doctor, could you give us some sort of timeline now, starting with telling us when was the department closed? Because he says, according to the records, that it shows that up till 22nd of May, patients were still being attended to.
Well, I don't know where the person has his own information from, but from what I can tell you, from the date I knew that this doctor was positive, we immediately closed down. In the first place, there is nothing that is written on anybody's face that says...
Dr. Adamu, when did you know and when was it closed?
I knew about it on, was it Monday or Tuesday?
What date was that?
It was on Monday, yes. I get to know about on Monday last week. That's a week ago. And that was 2 weeks ago. And immediately I heard about it, I instructed that the place should be closed.
When you say Monday, do you mean Monday the 18th or Monday the 25th?
I know it was a Monday, I think last week or thereabout, or 2 weeks ago.
Okay, because if it's Monday last week, that's the 25th of May.
2 weeks ago. 2 weeks ago, because I know last week Sunday, I visited the doctors in the isolation room. That's the doctors that were being treated.
Right. Okay, so that's the 25th. But then also making reference to some of the issues raised in that whistleblower's report. Now, the person said that the infection knowledge or the infection control knowledge, attitude, and practice is poor in the FMC. I'd like you to respond, especially what kind of training did you do? Because we know this is novel and a lot of people were not really prepared for this. So how were you prepared for this? How well is that infection knowledge imbibed?
I'm really surprised at this allegation as well, because as early as March, as soon as the first case was identified, we set up our task force for the management of the coronavirus disease in the hospital. And even as I talk to you, we have been training every staff, and in fact, including non-clinical staff. As I talk to you, from the cleaners, security, and everybody across board is being trained. There is no single staff who works in this hospital, whether it's on our employment list or is one of the outsourced staff. We do not make any differentiation. As long as you have contact with patients, you are our staff. And nobody has been excluded in this training. So I don't know where this information is coming from, but if you come to FMC Kefi, you don't need to be told of the level of awareness for this disease in the hospital. Because right from the gate, you will notice that, yes, there is a high level of awareness for this disease in the hospital. You will not even be allowed in until your temperature is checked, unless you are in your face mask, and you have several points for hand washing, use of hand sanitizers, and all over. And we've told people the do's and don'ts at every stage in the hospital. So I do not know what some people stand to gain by carrying stories that do not have basis. That's what pains me.
Oh, well, it's good you cleared the air on that. But also, is that during the course of interaction and training, have you found maybe doctors and nurses that don't believe that COVID-19 exists? Because we've heard reports. And if that is the case, what are you doing?
Well, frankly, I cannot tell you I've heard of any doctor or staff who who does not believe in the existence of the COVID-19 in this hospital. If there is, maybe it's a personal thing, and I'm not sure I'll be able to know that. But as far as I know officially, I do not know any staff who does not believe in this, because I remember at the outset of this disease, I personally moved around every department of this hospital informing and educating people before the task force took off. And immediately the task force took off, I allowed them, their education committee, part of their job on every day. As far as I talk to you, if you have anybody around, come to the hospital, you'll meet them at the training center. We have at least 4 training venues within the hospital where trainings are going on concurrently for every level of staff.
You know, but Dr. Adamu, the report, the whistleblower had the basis, because you yourself did say, you confirmed that there was a case like that in the gynecology department, which he also said. You said when you knew about it, you went in and you shut the place down, which he also said existed. So That's a basis for him to have raised some of these things. And is there anything wrong in people raising issues? After all, it's going to protect everybody else at the end of the day.
Medical personnel or not, we are all citizens, and they interact. We cannot prevent their private interactions. We do not follow them home after they close. So we do not know where they go or where they don't go. And when he comes back to work, and he's not showing symptoms.
It's not just medical personnel. My apologies. It's not just medical personnel interacting. It's medical personnel who are demonstrating every symptom of COVID. They have every reason to be concerned if they see that.
But I am not aware there was any report like that from ONG that somebody who is symptomatic was attending to patients. Okay, I'm only told that one of the doctors was sick, and when they mentioned the symptoms.
Oh, yeah. Okay, because I was going to ask him. So, okay, go ahead and tell us on what basis was it closed then?
As soon as.
Go ahead, doctor, if you can hear us.
Quarantine, and then we closed the department because we now know that it's beyond one person.
It's beyond one person now?
Yes.
How many cases now at the moment?
Three now, his two friends.
Oh.
There are three doctors. And the two all got through him, and they are all in the isolation and in the treatment center.
Oh, okay.
One then wonders, you are very shocked at the fact that someone blew this whistle. Are you saying that there was no basis for the person to have blown the whistle?
Yes, because if he says we allow those who are sick to be attending to patients, it's a fallacy. Because we don't do that. It is against the policy, and we know it very well.
Right, so on a final note, so the department is closed. What is the plan to open it? What are the indicators you're looking at before you open this? And is there a possibility that it has gone beyond the department too?
No. As I talk to you, we have already tested all those who were working with him in the department, whether they are his friends or working directly with him or indirectly, and all results, apart from those three, have turned out negative.
Yeah, but doctor, why did the hospital have to intervene to isolate him? Why didn't he isolate himself in the first place?
Well, he's a human being. I don't know how we don't have power to control his life. He brought himself around, and immediately we noticed that he was sent out.
But was it right for him not to have done or isolated himself?
The instruction we gave from the first day was, if you feel ill, stay at home and call the head of your unit.
But you found out that he was ill and he was still treating patients.
No, I am not aware of that. If anybody knows that, let them come and let us know. I'm not aware. The truth is, he came into the hospital and we discovered that he was sick and he was sent out.
Yeah, but that's the same thing. You discovered he was ill and he was coming to work, exhibiting symptoms of COVID.
No,
why was he then allowed to be coming to work?
Excuse me, sir. I didn't say he was coming to work. I was told he was in the call room, staying with his colleagues. And I think those two were the ones that become positive, along with him.
Okay, I'm afraid we've exhausted the time, but there's still questions. If he was in the call room, he came to work. Okay, but doctor, we appreciate your talking to us this morning.
Who are we to stop him? He has the control of himself.
No, but if you allowed him into the premises...
The policy, what I want you to understand, it is not the policy of the hospital. The fact that he breached the hospital policy does not mean it is the hospital policy.
If he breached the hospital policy...
You understand the difference?
I'm afraid you lost me there. He breached the hospital policy.
By coming into the hospital, because we told him clearly, if you have anybody who feels ill, to stay home. So if it's a breach of the hospital policy.
So are there penalties for people who breach hospital policy, for professionals at that?
I didn't get that.
Are there measures? What's the consequence of breaching hospital policy by a professional?
The consequence will follow after he's been treated. Because right now, he is a patient. I cannot take any punishment against him now because all we were doing was to make sure we keep him away. He's right now in the treatment center in isolation. So we cannot, exact any consequence, the consequence of his action on him right now. Because even in law, if you are sick, you are treated until you are well.
All right, Dr. Yaya Adamu, Chief Medical Director of FMC KEFI. Thank you very much indeed for your time this morning.
You're most welcome.
Well, back in a moment, everybody. Stay with us again.